back. I'm joined by Dr. Casey Harbine for another edition of Morning Rounds. Thanks for waking up with us today.
Yeah, you bet.
In June, it is Men's Health Month. I
Right.
forgot which month it was, but June, Men's Health Month. So why is this an important month to focus on?
So men are notorious for not taking action on their health, not thinking about it. I mean, women, we, seem to have more interaction with the healthcare system, but certainly in my job, what I've discovered, by the time I see men in the hospital, it's sort of when something's happened. And so June is a time to really try and focus on raising awareness and working on prevention things so it doesn't kind of come all to a head at once.
And this question, of course, obviously to me, but do men need regular checkups, and when do they need these checkups?
Yeah, honestly, it's never too early to establish with a primary care provider, but certainly by the time a man's in his 40s, he should have a primary care provider. Earlier, if there's a significant family history of chronic illness. But, really you want to start with early screening, especially for things like heart disease, work on prevention, look at high blood pressure, risk for obstructive sleep apnea, elevated cholesterol, even start some cancer screening early, and absolutely by the age of 50 when colon cancer screening starts, really they should have a regular doctor that they're able to check in with.
And bringing up heart disease, are men at an increased risk of that?
Right. They very much are at an increased risk. It's much more prevalent in men, and it tends to strike men earlier than in women. So, it's important to know the signs of the heart attack. It's not just chest pain. It can be something as simple as a jaw ache or shoulder or arm pain, shortness of breath, or nausea, particularly with exertion, when they're just doing their normal jobs during the day. And it's also important to kind of be aware of family history and different risk factors. Smoking is a big part of it, and elevated blood pressure. We talk about this being the silent killer. It's because people walk around with elevated blood pressure all the time and feel fine, and they don't know that it's the leading cause of heart attack and stroke.
Now, switching topics a bit, depression, that can also be a big health concern for men as well, right?
Right. There's actually, thankfully been a recent focus on this. In the last few years, there's been some somewhat shocking data that's come out that showed the only group that has increasing mortality, people dying more and earlier than ever before, are middle-aged white men. And this has a lot to do with the opioid epidemic and depression as well. Men are more at risk. They tend to be more isolated. And so it's really important to establish with a primary care provider, at least to try and reach out to look for signs. Even grumpiness is a big sign, to address these things and help.
All right, well, thank you for discussing some of those issues with us here on Morning Rounds. If you have something you'd like us to answer, you can email it right to us, morningrounds@kpax.com.